The White House says it has, quote, beat Big Pharma after Medicare reached agreements with drug manufacturers to lower the prices of 10 of the most expensive drugs in the United States. According to the Department of Health and Human Services, Americans will save about $100 billion over 10 years as a result of these negotiations. However, these new prices will not go into effect until 2026. Health and Human Services Secretary Xavier Becerra is here to delve into all of this and more. His agency oversees Medicaid and Medicare. Hello to you, Mr. Secretary. Thanks so much for joining us. You were right in the middle of all of this. So take us into the negotiations that led to these new drug prices. What were the talks like? Were some drug companies easier to negotiate with than others?
Nancy, it helps when the team is prepared. We did a lot of homework. We got a lot of information. We spoke to a lot of people. And so when we went in, we were fairly prepared, and that made for some good conversations. We made some offers and counter offers on both sides. And what we're able to do is get this done on the timeline Congress set for us. And 10 drugs, 10 negotiations, 10 reduced prices. That's a good a mark, and I think it's a good omen for what can come when it comes to drug negotiation.
Why these 10 drugs in particular, Xarelto, Jardiance, Eliquis, what have you? And why were you able to secure, say, a 79% reduction in price for some drugs, like the diabetes drug Januvica, and then a smaller price reduction of 38% for something like a blood cancer drug, Imbruvica?
So the why those 10, Congress was pretty clear in its direction in the law on how to select the drugs. The 10 most expensive drugs in the Medicare program, of the 3,500 plus drugs, these are the 10 most expensive. So expensive that just those 10 out of more than 3,500 take up more than a fifth of all the costs that are spent on drugs in the Medicare program. And so these are some familiar names, and they're very important drugs to many people: diabetes, heart disease, stroke, kidney failure, all the types of conditions that really are critical, cancer. And so when it came to the negotiations, we took a number of things into account. And I must, again, remind you that very rarely do you pay sticker price for anything, whether it's prescription medication or whether it's a car at a dealership or whether it is the clothes that you're going to buy in the department store. You usually can get it for far better price, especially if you can negotiate. And now that we can negotiate, we got a far better price.
Have you already identified the next 10 drugs that you want to negotiate? Are they just the next 10 most expensive after these?
We will be announcing that by February of next year. CMS, our Centers for Medicare and Medicaid Services folks, our team will go through the same process to identify the next set of drugs. And we will announce that, and we're going to be transparent as we were with this first set of drugs.
Secretary Becerra, how much difference is this going to make for seniors when you already have a $2,000 annual cap on prescription drug costs that is going to go into effect next year anyway?
Yeah, Nancy, that's a great question, because people are going to begin to realize just how fantastic this Inflation Reduction Act by President Biden, Vice President Harris, really is, because it's not just that today insulin is capped at $35 for a full month's supply for people on Medicare, which is big news already. It's not just that today the overall total amount that you'll pay out of pocket is about $3,500. And for folks who are on a cancer drug, for example, $3,500, it could be 1 or 2 months worth of that cancer drug. But the fact that in 2025, in just a few months, the overall total cap that you can spend on drugs out of pocket will be $2,000. That's going to be a great thing. But here now with the negotiations, what we get to do is not just save the Medicare program a lot of money. In this case, just 1 year of negotiation on 10 drugs, it's about $6 billion. On top of that, there are the savings that Americans on Medicare will save by not having to pay as much out of pocket, because some of these drugs are pretty expensive out of pocket. Sometimes you have to pay 25, 30% of the cost of the drug. And so that could add up. The fact that that will occur, the savings will occur for out-of-pocket expenses as well. We estimate about $1.5 billion for the Americans who use those particular drugs on Medicare. That's savings that stays in their pocket on top of the $6 billion that we're saving the Medicare program. Good stuff, but overall, it's everything the Inflation Reduction Act does that really will help Americans when it comes to drug costs.
Right, a savings for Medicare is a savings for taxpayers. Secretary Becerra, you were at the event in Maryland today that President Biden and Vice President Kamala Harris held together. Tell me a little bit about your working relationship with Vice President Harris. How extensive has the relationship between the two of you been over the past few years?
The Vice President and I have worked very closely. Our teams have worked very closely since we've both been here in Washington, D.C. in the administration. Remember, the Vice President was our point person on reproductive rights. And so she's been out there. I've been out there because Health and Human Services has been impacted by this. We've worked together on maternal health because we've got a real big focus on improving the condition, health condition for women and their babies. And that's something that the Vice President has been on top of as well. So on many occasions, we've been to the same parts of the country working together, and we've focused on some of the same issues. I've known her since she was senator. I've known her since she was the Attorney General. I took over as Attorney General of California when she became the senator for the state. And so we've worked together for a long time, long working relationship. I've known her well, thrilled for her. And now we know she's going to focus on some of the things that HHS considers priorities.
You mentioned that you're the former Attorney General of California. You're also the former congressman from California. I know you've been mulling a bid for governor of California in a couple of years. Is there any news you'd like to make here on America Decides?
Well, if I were to make news here today, Nancy, you would put me in real trouble with the law, because when you are working in the federal government under the law called the Hatch Act, I can't be out there talking about doing campaigns and doing political stuff. So I am secretary, and I'm thrilled that the president gave me a chance to do this. I will continue to be secretary as long as that lasts. After that, we'll see. But I appreciate your asking. It's a pretty rewarding thing for folks to say, "Hey, are you thinking of doing this or that?" And when it's something like governor or secretary of the U.S. Department of Health and Human Services, that's a nice little treat.
Well, when you are ready and able to talk about it, we hope you'll come back. Secretary Xavier Becerra, thanks so much. Appreciate it.
Thank you.